Thank you so much, Dr. Rukia, for those kind words. And at the outset, I would like to thank the entire team of Diabetes India and DGenius for having me here today to speak on a very important and relevant topic in our day-to-day practice, that is role of family dynamics in managing diabetes-related mental health. Often we do not spare much time to discuss with the patient about any mental health issues associated, but that forms a very important part of managing and treating diabetes. So in the next few minutes, I'm going to take you through understanding diabetes and mental health, the role of family dynamics, and what are the strategies for improved family support. So mental health challenges in diabetic individuals are very important, and they can be detrimental in managing the blood sugars if left neglected. So diabetes related mental health issues, things like depression, frustration, stress, anxiety, worry about taking insulin, and worry about low sugars. So how do they really affect the management of diabetes? Now, diabetes management can be stressful, leading to anxiety about their sugar levels, dietary restrictions, and the risk of having complications, which affects their overall health. It also has a negative impact on the quality of life because the physical and emotional demands of diabetes can significantly reduce the quality of life, making it essential to address both medical and psychological aspects for overall wellness. Now, depression is also very commonly associated in people with diabetes. They are more likely to experience depression because of the chronic nature of the disease and the daily management tasks required, influencing their mental well-being. So now comes the crux of today's talk, the role of family dynamics. We all know that a positive family influence is very important and plays a good role in managing their blood sugar levels. Emotional support from the family members is always needed because it fosters a sense of well-being, belonging, security, and stability, and this contributes to the well-being and resilience during challenging times. Encouraging healthy habits and families play a crucial role in promoting and maintaining healthy habits such as balanced eating, regular exercise, and ensuring sufficient sleep, which are fundamental for long-term health and vitality. Active participation in management from the family members is equally important because families can participate in daily routines and responsibilities, including financial responsibilities, sharing the household tasks, and this in turn leads to a more organized and less stressful environment for all the members in the family. So positive family interactions are important. Supportive communication is required, and effective communication within the family can help in sharing essential diabetes management tips, providing support and ensuring clarity about their daily routines. Shared meal planning and nutrition also helps because families who can plan their meals together can ensure the inclusion of a balanced diet, diabetes-friendly foods, and make meal times more enjoyable and promote healthy eating habits. Encouraging physical activity is good. Active involvement in physical activities as a family can boost their motivation, improve their overall health, and make exercise a fun part of the daily routine, which otherwise is not. And on the contrary, negative family influence can be detrimental to blood sugars. People could be experiencing family conflicts, frequent arguments and tensions among the family members can lead to a stressful home atmosphere, which adversely affect their mental health and their relationships. Lack of understanding could be there between the family members, and when family members lack proper understanding, lack empathy with each other's needs and perspectives, it can result in feelings of isolation and hinder the effective communication and support. And sometimes there could be overprotection or neglect, both of which are not good. And overprotective attitude limits independence, and neglect can lead to feelings of unworthiness and abandonment. So negative family factors have a detrimental effect, as I already told. Stressful relationships could negatively affect the blood sugar management and overall diabetes care. Again, when family members lack the knowledge about diabetes, they might struggle to provide adequate support, and this potentially leads to poor management of the condition. So what are the psychological effects of diabetes? Now, dealing with diabetes means dealing with chronic illness, anxiety, which refers to a persistent worry or fear that can arise from managing a long-term condition like diabetes affecting their overall well-being. Depression is linked to blood sugar fluctuations, and blood sugar fluctuations can have a direct impact on mood and mental health. This can lead to feelings of sadness, hopelessness, or depression in people with diabetes. So what are the strategies for improved family support? Families should foster love, success, happiness, and together support each other. So coming to the role of family in mental health, providing mental health support, it is very important because they play a crucial role in providing emotional support, in helping diabetic individuals cope with their condition through empathy, understanding, and good companionship. And they can also help by facilitating access to mental health resources, which means they could connect the individuals with professional support services like counseling people or support groups to manage their mental health effectively. And they could also, as a family, help them in recognizing the signs of mental distress. Now, this involves paying attention to changes in their behavior, mood, or routine that may indicate underlying psychological issues in diabetic individuals. Providing education and awareness to the families is also important. Family counseling on diabetic management must be done, and this involves educating the family members about the importance of diet, exercise, and medication adherence in managing diabetes effectively. Frequent workshops on mental health awareness should be conducted for the families, and they help the family to recognize the signs of mental health issues and also help to reduce the stigma most often attached to diabetes. And they can also provide strategies for supporting the affected family members. Counseling and communication part forms an equally important role, and diabetes education for families is very important, as I just told. Open communication channels must be ensured, and this allows the family members to discuss the concerns, to share their experiences, and seek clarity on managing diabetes together, which fosters a supportive environment. Now, professional counseling is very important, and this offers families great guidance on coping with the emotional and psychological impacts of diabetes, enhances the collective resilience and management strategies. Building a supportive environment is what is needed. So establishing healthy family routines, this includes setting regular times for meals, exercise, and sleep to promote overall well-being and stability within the family unit. Regular family meetings and check-ins also have a positive impact, and because they create opportunities for open communication, they help in addressing the concerns and also to strengthen the relationship between the family members. Utilizing community resources and support groups also forms an important part. This provides families with additional assistance, educational materials, and social support from others facing similar challenges. So to conclude, by understanding and promoting effective coping strategies, families can contribute significantly to the overall mental health of their members living with diabetes. So each one of us, it is very important to spare a little time with every patient of us to see if they are struggling with any mental health issues and help them to cope with those mental issues so that we can improve their blood glucose control as well. Thank you, everyone.